Basically, by aggregating all the client's effects, we have no interest in saying that this particular client is X, Y, Z. That's a clinical decision that the clinicians should make, and we would always argue that it's the clinician's job to really understand the unique client and work with the unique client. What it does do, however, is that by having a standardized way of measuring how the client is doing, the therapist has two things that they could quickly learn from. One is they could compare how that individual client may be doing compared to the average client, which may give clinical insight into how much the client is improving or not. Maybe it might give signs to doing something differently. The other thing is by using these standardized questionnaires, it allows the clinicians to, in some sense, in a very brief way, ask specific questions that in a typical session we may not be asking, and therefore the client may not be sharing with you. And I could speak as a clinician. I don't ask all these questions in the beginning with my clients. And so I'm going to be naturally missing some of the questions, and it might be very important, such as substance use, suicidal ideations, things like that, which you think it's pretty typical and you would hope that it would naturally come out in the session. But that's not exactly true, because we get really focused in the session and really work with that material rather than gathering broader symptoms and distress that the clients are feeling. So those are the benefits of actually having a regular standardized assessment. And I don't see how this can't affect your, be enhancing your practice rather than hindering it. And we're talking about maybe 2 minutes of the client's time. The amount of information that we could get from 2 minutes of the client's time, I think, is enormous.